Teaching Imitation, Mimetic Behavior, Autism Training Solutions. It is difficult to overstate the important role that imitation plays in learning and development. Imitation is perhaps the most fundamental means of acquiring new behaviors and knowledge for humans. Imitation refers to the emission of a behavior that is topographically similar and temporally proximal to the behavior of a model. In other words, imitation means to mimic another person's behavior. Infants and children absorb vast amounts of information through the imitation of others. Imitative learning allows children to observe, then practice and rehearse the behaviors they've seen, and leads to the mastery of countless new skills. Once a generalized imitation repertoire is established, the learner has acquired a response class of doing as the model does. These imitation skills play a powerful role in behavioral development of children. The emergence of language, social, daily living, and play skills are often products of generalized imitation. In typically developing infants and children, imitation skills emerge early in development and occur naturally, such as a child imitating their mother clapping during patty cake. This imitative learning is instinctive and effortless and provides them with an easy means for acquiring new skills and knowledge. Most children with autism spectrum disorders, however, have what has been called a core deficit in the ability to imitate. They often show little interest in the behaviors of those around them and do not often attempt to imitate what they see. Poor imitation skills indicate that the child with ASD is not observing and learning from the world around him. Failure to imitate means that new skills are not practiced, rehearsed, or mastered.
Do this. Do this.
For typically developing children, imitative learning happens naturally through observation and imitation of the behaviors of others. But for children with ASD, these behaviors often require direct teaching. Teaching imitation skills is an extremely important focus of early intervention and provides the foundation for more advanced learning.
Do this.
Also, once a child learns to do as the model does, model prompts can be incorporated into the other instructional programs.
Do this.
The instruction of an imitation repertoire requires that skills are broken down into its most basic components, then taught and reinforced. Then the skills can be expanded by increasing the responses with more difficulty and complexity. The end goal is to generalize imitation skills so students are able to copy the behaviors of others, especially peers, and continue to imitate behaviors in the absence of direct instruction and continuous reinforcement. Our aim in teaching foundational imitation skills is for imitative learning to become a natural way for the child with ASD to learn new behaviors and skills.